Bruno Falissard, thank you so much for joining me and talking to ESCAP today. Ahead of your keynote presentation in Maastricht, your presentation has got the same title as your editorial that you published in the ESCAP journal in February of last year, and it's titled, "Did we take the right train in promoting the concept of neurodevelopmental disorders?" Are you expanding from your editorial? What is the real issue with this terminology of neurodevelopmental disorders?
Yes, it could appear a little bit provocative, but in fact, this is very serious. And I think this is very important for our profession. We know now that many of our patients have problems in their life, but this problem comes from their brain too, of course. But we have to be very careful with the words we are using and with the definition of disorder we are proposing. Because in the past, physicians had a very important authority. They could say, this disease, it is this definition. There is schizophrenia, depression, and we are physicians, we know what are mental disorders. This is no more true today. Since 2000, 2010, many mental disorders, what we call mental disorder, like autism or ADHD, are now considered as an identity by this patient. They are autists. They have ADHD. This is them. This is not a disease. This is an identity with problem. But this problem comes mostly from the society. The society does not accept them as they are. And even this way of being has also some good points. As you know, with autism, with hyperactive patients, they are creative, they are fun, etc., etc. And what do we say today? We say this is a neurodevelopmental disorder. What is the definition in the very famous textbook? This is an impairment or delay in the development of functions that are strongly related to biological maturation of the central nervous system. And there is even the notion of deviant functioning. We are saying that people like Greta Thunberg have just problems in the development of their brain, while this young woman is going to save the planet. So and I understand colleagues that say that autism is in line with the development of the brain. And in a way, this is true. But we have to consider society as it is. And society now considers that autism and ADHD are different with good and bad points. And so we have to adapt the definition of our disorder, taking this into consideration.
You mentioned about these societal changes, and society is constantly changing. Do you think child and adolescent psychiatrists are changing quick enough to adapt to these trends?
Not. Of course not. Our society is changing at a very high speed at the moment, as you know, because of technologies, because of the internet, because of the eco-anxiety. We are afraid because of the future of the planet, and in particular, young people. And the pandemic, of course, give a very strong acceleration about that. And we are not moving that fast because we have textbook, we have Congress, we discuss, but we don't take into consideration that patients are changing, society is changing much faster than we consider our specialty.
How do you think we can combat that? Is it an education issue with young psychiatrists moving forward into society?
Yes, I am very surprised by the fact that young psychiatrists have a strong feeling of that, much more than me with an old guy now. And so this is the good point of the story. Young child and adolescent psychiatry, they are ready to move faster. What we have to do is to discuss, and this is why the Congress is so important. We have to take time to stop, not being in the clinic as we are every day with so huge amount of work. We have to stop, to discuss, and to see the problem like they are really.
Exactly, and you also mentioned we mentioned about the young psychiatrist, you're also going to be involved with the Research Academy as well, and talking about methodologies and research. Is that a way as well forward to adapt to these changes and to implement maybe new technologies? Or
in medicine, technologies can be very good for patients. There is no doubt about that. And if you look at the progress in cancer, for instance, this is amazing. And I am sure that one day we will have the same progress in child and adolescent psychiatry. But we need also to do research in sociology, anthropology, history, because this is a way to understand societies. And societies are very important in our discipline. When you look at what is our profession, in a consultation, we face a family.
mm-hmm.
Our patients are at school. The parents can have a religion. All that has to be considered in the treatment. And high technology will not bring any progress with that. We need also social and human science. And I am sure that our young colleagues are ready to do that.
Do you think that child and adolescent psychiatry needs to adapt with other medical disciplines and other childcare professionals more? What's the future for that?
Of course, you are right. We need to have strong link with adult psychiatry, because our patient will become adult one day, and this is called the transition, and we are not good about that. We have to have link with pediatrician, because more and more, and because of the pandemic, pediatricians are in first line with child and adolescent psychiatric patients. So of course, I would say even just the opposite. The rest of medicine has a lot to gain to learn child and adolescent psychiatry, because we are really the specialty which is the closest to the society and to the future of society. And in many disciplines, colleagues are too close to monoclonal antibody, imaging, etc. They don't see, for instance, that obesity is a societal problem and not a problem of leptin or things like that. So we have to show the way too.
Brilliant. Bruno Falissard, thank you so much for talking to ESCAP today. I'm sure that many of your colleagues are looking forward to discussing with you in Maastricht. So thank you very much.
Thank you.